This is Glenn Healy.
Hi, this is Braden Holtby.
This is Daryl Sutter.
Hi, this is Brian Burke.
This is Jordan Tutu.
This is Keith Morrison.
This is Kelly Rudy.
Hi, this is Scott Hartnell.
Hey, everybody. My name is Theo Fleury.
This is Tim McAuliffe of Sportsnet, and you're listening to the Sean Newman Podcast.
Happy Friday, folks. Welcome back to the podcast. I've been putting out a lot of content here over the last month, and as things continue to progress, it doesn't have, or it doesn't look like it's going to slow down at all. You know, we recorded this episode about a week ago, so at the time, I should give a little bit of the backstory. I met Sue at a For the Kids' Sake meeting, and I heard her story, and I was just kind of like, wow, I'd really like to talk about that on the podcast, you know. A bit of her story, which you'll hear in getting, you know, kind of forced or pushed towards getting the vax from her job. And once again, you're going to hear all about that. And it's funny what a week brings, you know. First it was Jason Kenney, now Scott Moe. And I feel like there will be more of these stories. They're already going on. We all know it. And more of these stories will be coming out. And there's a lot of people saying, it's just one of every 10 people, maybe 10% is getting pushed this hard. And here in town, you know, you just starting to hear more and more companies are going to be mandating the vaccine, and that's going to be it. And, well, I guess we'll wait and see what happens here. At the time when I heard Sue's story, I hadn't heard many stories like this, and hence me reaching out, wanting to put her on the podcast so we could talk about it so people could hear it and go, oh, wow, it is actually happening. But I fear now with first Kenny, Mo, that more of these stories will be coming to light very soon. And it's odd how, I don't know, the universe works, because it was supposed to come out a week or two ago, and then it just got pushed. So without further ado, here is the T-Bar 1 tale of the tape. She lives near St. Paul, Alberta with her husband and 3 children. She's a licensed optician since 2001, worked in long-term care from September 2020 to June 2021. She's a mom, wife, and concerned citizen. I'm talking about Sue Stybel. So buckle up, here we go.
This is Sue Stybel, and welcome to the Sean Newman Podcast.
So welcome to the Sean Newman Podcast. Today I'm sitting with Sue Stybel, and I hope I said that right.
You did.
Perfect. Now, I brought you on. We got talking when we met in Kid Scotty a few weeks ago about a couple different things and your dealings with a school district and kind of a school, and just kind of what happened, transpired. It's still in the courts, and I'm not saying it resembles what's going on right now, but I got a wife who's a teacher. And I hear about the parents just absolutely losing their beans on teachers, principals, about mask mandates, about how this, that, and everything's being rolled out during COVID. And I always, I come back, I'm married to a great woman who has great principles, who wants nothing but the best for the kids, and yelling at her ain't going to change things that are being pushed down from on top. Mm-hmm. Now, in saying that, I know these don't exactly, it isn't, apple to apple, so to speak. But I wanted to kind of hear the story of what transpired in St. Paul and kind of get some background. But maybe before we hop right to there, could you maybe tell the audience a little bit about yourself so it kind of gives some context?
Sure. So I'm just a regular average Joe like everyone else. I'm a parent first and foremost, and I have 3 kids in the school system. So on the side job, I'm a licensed optician. I owned my own business, so I kind of have that small town, small business aspect to it as well. And I also worked in long-term care over the past, 9 months. So I had to leave that position in June under unfortunate circumstances. But I kind of got entangled in that scenario as well. So again, just an average person with various different experiences throughout.
Do you care if I ask what that situation is?
Sure.
Are you allowed to talk
Yeah,
about it?
I'm allowed to talk about it.
Well, we can start there if you'd like.
Sure, if that's where you want to take it.
Well, you just mentioned it, so
Yeah.
I mean, it's gonna sit on my brain now for the next little bit.
Okay. Yeah, because it is definitely a very heightened situation at this point. So I will say I'm actually a little bit relieved that I'm not sitting in the situation right now, because I can't imagine at this particular point in time with what's been announced with, the absolute mandate to vaccinate. So I actually started my position last September as an office coordinator. I was actually hired as a COVID screener. I thought I would take, just a casual job, seeing that I had decided to shut my business down through COVID. It was just too much. So I took on that position. I ended up jumping into the office coordinating position, and I loved it. I have to say that it was not my goal or life aspiration to get into long-term care, but I found out really quick how much I loved it. I loved working with the residents, and but on the flip side, I learned that it was a very difficult atmosphere to work in. So shortly after I started my position, we went into lockdown, complete lockdown, which meant one or two family members could come in under, with strict rules, masking, shielding, all that stuff. And I would describe the atmosphere as a giant game of Simon Says. So Alberta Health Services had, 50 million mandates thrown at you. Some of them made sense. Some of them made absolutely no sense. So throughout the actual lockdown that I was in, we were only masked. So we weren't forced to shield at that particular point in time. So we weren't vaccinated and we weren't shielded. The vaccine hadn't come out quite yet. With that said, it was probably some of the most traumatic experiences I've ever lived through. So you're dealing with distressed residents that have dementia, residents that don't even understand what's going on. So some that are trying to, escape out of the doors, some that are, lost, sad, depressed. So it became a very big, I would say we were like mental health experts in there trying to just survive because we were so short-staffed. And what most people need to understand is when they say the word outbreak, it doesn't mean, the whole building got COVID. It means one. So one person or one staff member has to leave the building, you're on outbreak. So the rules became very, very strict. We worked through that. We got through that hump, thank God, with, short-staffed, which meant that I was actually on the floor at that point, feeding residents, whatever needed to be done. We pulled together as a team and we did it. We were also left very exhausted, again, shorthanded, short-staffed, scrambling, and we became robots in that building. We became glorified robots. And probably the most disturbing part to that was the criticism that came from the outside. So we weren't doing it good enough, or, it must have been, a staff member who brought COVID in the building, or it became a very hostile, I would say, very hostile, very demanding. And when the vaccine rollout did come out, we became, so that facility, although I can't name the facility,
Sure.
The facility became a pilot project, and that's what it was called, a pilot project. That sent a major red flag to me. So that tells me that I'm going to be documented. Everything I do or don't do was documented. And that, in the back of my head, that became a giant red flag. So that happened in the very end of December. So December 28th to be exact. So we kind of came out of the outbreak. We got the okay that we're no longer an outbreak, which really didn't mean a whole lot. The rules didn't change a whole lot. So family members were still restricted. The doors were locked. There was no, it meant services were also on hold. So the residents, weren't getting their pedicures or anything like that. They were very restricted to activities they could do. So it was very boring inside that building and not a lot to do, lots of confusion. So again, most of our days were spent either consoling or just surviving. We were in total survival mode, and they still are. My heart goes out to them still to this day. But when the pressure became so intense, when it was announced that we were part of the pilot project, the expectation was we were supposed to be elated that the vaccine rollout was in our building and we were the first ones in Alberta to receive it. I was very cautious at this point because we had just made it through an outbreak, and now they're going to be, pushing the vaccine, although they didn't call it a mandate. At the time, it was called voluntary. So we're like, okay, it's voluntary, so, we're not pushed into position. The verbiage is what really bothers me. So on paper, it wasn't mandatory. Behind the scenes, anybody who declined, they said refuse, but in my opinion, we've just declined it. You were pulled into offices, private meetings. You were pressured. You were bullied. I was tremendously bullied on multiple occasions. I saw, because of the position I sat in, several members of the team, of the staff, ushered into offices, doors shut. And at one point, there was a public health on speakerphone waiting for staff members to be ushered into a room to say, hey, we just want to book your vaccine. And so it really puts people into a really precarious situation. And I don't know who all booked and who didn't, but I can tell you that statistically, at the beginning, we sat at around 60% that chose to get vaccinated and 40% who didn't. By the end of their campaigning and their pressuring and what I would consider outright bullying, we then moved to 90%. So it worked. I would say it worked. Lots of people perhaps didn't want to take it, didn't feel comfortable taking it, but caved to the pressure. And there were some that have a lot of regrets. I stood my ground. I said no, and I publicly stated no means no. It meant no the first time, it meant no the second time, and it doesn't mean no until you convince me to say yes. It means no. And I even brought up the fact that we teach our children, we teach our girls, no means no. Why does it not mean no in this situation? So I did respect the fact that they left me alone for a bit. I was left alone. I did my job. I showed up every day. And, no matter how difficult it was still rewarding because I got to spend time with such precious people. Like the elderly, there's some that aren't even elderly in there. There's just some really neat souls, and I felt like it was a privilege to actually be there, to, get to know humanity on a different level. And it actually brought me joy despite all the other, stuff that I had to deal with. But then the line became even thinner where, unvaccinated people had to keep their shield on and the vaccinated people were able to take their shields off. So now it became like visible who's vaccinated versus who's not vaccinated. And I said, I'm not comfortable with this. I find this flat out discrimination and I want to discuss it. I'm not denying, I'm not disobeying orders. I want to know why. So as my background as a licensed optician, I dealt with safety eyewear for 20 years. I know the ins and outs of safety eyewear. And so they were promoting the shield like safety eyewear. Well, shields, they look like they're made out of pop bottle material. There's nothing safe about a shield. They're actually a hazard. So my concern with the shields were for the past 8 months, we've been masked, we've been shielded, and we're dealing with vulnerable people who are deaf, who have dementia, who need to see our face. They haven't seen our face in a year, basically. They can't hear us. And it really hindered communication. So I'm like, my job as an office coordinator is communication. And I can't even communicate with a resident who I'm shouting at. And so I said, I'm not participating in this anymore. So when you have the answers for me that are logic and make sense, I'll wear the shield. Until then, I'm not wearing it. Nobody needs to know my vaccine status. My coworkers don't need to know my vaccine status. Neither do families entering in. The only thing that should matter is the residents at hand. What's best for them? And so I was left alone for several weeks after that. And, several other workers actually left on stress leave. Some, it became very clear that the situation was going to get much worse. And then I was expecting it, actually. I shouldn't say I was blindsided. I knew it was coming. I had a feeling that they wanted to use me as potentially a token of...
An example.
And as an example. And I was greeted by the regional director one morning, unexpectedly. And I thought, perfect. She was the person I was guided to ask these questions to. I thought, okay, that's not at all how it went. I thought we would have a friendly discussion. I was basically shamed. She advertised that she knew that I wasn't vaccinated and that I needed to put my shield on. And I just, I actually asked her how she knew that information, because to my knowledge, medical information should have been kept private. And I had known that a mass email had gone out to various members that had no business knowing anything. Like, these were office coordinators and just random people, that a list of people who were not vaccinated was circulated. And I'm like, this is getting to be too much. And she basically said, you either put the shield on or you get out. And so I made a conscious decision at that point that I would walk out. And so I received a letter following that I asked her on the spot, am I fired? And she refused to answer the question. I said, I'm going to ask you one more time, are you firing me? And she refused to answer the question. I said, well, by your lack of response, I'm assuming that you're wrongfully terminating me. So am I correct in saying that? She told me to get out. So I politely thanked her, and I actually even followed up with a letter saying that I'm actually grateful I had the opportunity to work in long-term care, because I never would have understood what actually went on. And I have a tremendous amount of respect for the healthcare aides that are boots on the ground, caring for your loved ones. And it's really tragic what's happening.
Well, I was going to pop in at some point, because here was the average age of death from COVID in 2020, 83.8. So
Yep.
84 years old, 83 years old, over 80.
Yep.
Well, where do majority of those folks live?
Yeah, they live in long-term care.
So you can, I don't mean the pressure on
Yep.
you was correct or anything like that.
Mm-hmm.
You can understand the government's trying to protect people, and they're trying to
100%.
figure out how to do that.
Yeah, 100%. I understood both sides of the coin, which is why I questioned what needed to be questioned, and I stayed as boots on the ground when needed. I understood that if it was for the safety of the resident and the safety of my coworkers, I totally understand. But it no longer became that. It became politicized, and it became, well, if you're vaccinated. And they even sent us, so they pressured us to take part of town halls, which I was more than happy to. Like, the more I can understand about what's actually going on.
I think all of us are in that boat.
Yes.
The better off we are.
Yeah, so I
Thank you.
wasn't, digging my heels in and being, rebellious. I wanted to know the facts. So the facts that were actually presented to us via email, so I have all the emails, and via town hall, which the town hall was actually with Dr. Dina Hinshaw too. So I had that opportunity, and I'll explain that in a moment. It basically stated that they did not have any information on transmission with unvaccinated versus vaccinated. So right there, that told me, okay, well, a vaccinated person and an unvaccinated person are equally risky. There's no difference.
Yeah.
You can both transmit COVID the same way.
And what do we know now? You can transmit both.
You can transmit both. So that was off the table for me. Okay, well, I'm not putting residents at risk then any more than the vaccinated person. Okay, so that's off the table, right? Okay.
That is shocking to people, though, because
people just can't grasp that.
No,
they keep trying to use it as a you're dangerous. Well, I'm no more dangerous than you are.
Well, but in fairness, I don't criticize people. Like, I criticize myself for a long time with the podcast because I stayed away from this topic, and it's very uncomfortable to have people in here and talk, right? Like, I keep saying this, right? Like, look around the room. I'm a hockey guy. I don't know what I want to do. I want nice and fluffy stories and have some laughs and a beer or whatever.
Mm-hmm.
The thing is like, I've been following along and doing as much research, and sure, if I stumbled on, I say this all the time, right? You go down the rabbit hole of trying to figure out all the research. Are you gonna find some bad information? Yeah, but I hate to break it to you. If all you do is follow mainstream media, they're gonna give you some bad information. Oh wait, if you're vaccinated, you don't transmit. And anyone who says that they said that you would from the start, I don't remember ever hearing that. No. Do you ever remember hearing flipping on CBC or CNN? Oh, if you get the vaccine, you don't like, come on. Like they may have skirted it and said it in a different way, but nobody ever thought in our area specifically, I can't speak for the rest of the world, that if you get the vaccines, you're going to have to worry about transmitting everything, right? Everybody was like, no, I can't even get it again. Well, that isn't either, like...
I know.
Right?
Yeah.
I'm not saying anything on the... Like, I'm no doctor. Mm-hmm. I'm just a guy watching and going and like you say, questioning things. Like,
I just question, and I think that's what
it makes
got
people
me into hot water is I question.
Listen, Sue, questioning things makes people uncomfortable.
Yeah.
Just go along. Just get vaccine. Just come on, make life easier.
Yep.
Right. But the thing is,
I heard that all day long for 8 months, or for the 6 months, I should say. It wasn't 8 months.
The thing is I just come back to like, yeah, but like we're talking about this is me. Like, this isn't like wear safety gloves, right? Protect your hands. This is like put something in me that never comes out ever again.
You can't reverse it.
You can't.
This is irreversible. And what did not make sense to me, that I questioned the most, is I worked the outbreak. I was around COVID. I didn't treat anybody any different. It's like if so-and-so needed to be fed, I would feed them. I was around COVID with strictly a mask. That's it. That's all I had on. I was fine. There were a lot of, and don't again judge, there were a lot of scared workers who, and I have, hey, they couldn't understand why I wasn't scared. And I can't explain it. I'm just not.
Yeah, but
I'm not afraid of it.
But in fairness, like right now there's people that are scared, right? We got Delta.
Oh yeah, there's a new one, Moo, I heard, but whether that's true or not.
Here's the thing I'll say about Delta, because I was reading through my notes. You know, me and my wife were having a discussion, and I've now had on several doctors. I got informed today that Governor from town is going to come on. I'm excited about that because there's a guy at the top of Lloyd who is pro-vax and everything else. I'm really interested to hear something that isn't my narrative, so to speak, right?
Which is why I went to the town halls.
Right, because
Inform me. Tell me, what am I missing?
What am I missing? Like, I'm interested in all the things. And I think when we get on our sides and you don't talk to the other side, you become divided. And then that's when real problems can really start. Well, look at what's going on right now.
Yeah.
Like, that's what's happening.
See, I'm kind of ahead of the ball in that aspect because I lived what we're dealing with right now. I lived inside of long-term care because it did become you versus me inside of that building. So it's like, oh, so-and-so was wearing a shield. She's not vaccinated. Isn't that nice to know? And like, it became...
You got to have pretty thick skin.
You have to have extremely thick skin, which...
Well, once again, I go back to... So my wife and I had a discussion, and she's like, if you're going to have all these conversations, why don't you, like, figure out things that are, like, transferable? Like, you actually learned this and try and, like, what's the word I'm looking for here? Like, No, I can't even think.
Well, this is what really bothered me, and this is my question to Dr. Dina Hinshaw, which I was grateful I was able to ask. Because what bothered me, of all the things that bothered me, this is what bothered me the most. So a resident who's been double vaccinated, which we were the pilot project, so the residents were double vaccinated at this point in time, by the time I spoke to, or was able to ask my question. Explain to me why a double vaccinated resident who had to leave for some reason, go to the hospital for whatever reason, when they came back, they were forced to isolate for 14 days by themselves alone in a room. And anybody that entered that room was basically dressed in a hazmat suit. You were gowned out the wazoo. That residents also tested negative for COVID. So before they can even come back to the facility, they have to have a test, a COVID test, PCR test. So not even just rapid test, an actual PCR test. So they test negative. They're double vaccinated. And you're telling me a suffering resident who's basically come back to pass away, that's the reality of long-term care, is alone in a room for 14 days. And anybody that has any contact with him, including staff and family, so, you were allowed to bring in a couple family members at a time to, console. How do you console dad or grandpa or mom or whoever in a hazmat suit when they're dying? They don't have COVID. We don't have COVID. And you're telling me that that's humane? Like, where have we come in society that that's acceptable? Like, he didn't have COVID and we didn't have COVID. And we can't even console the resident that's dying. There wasn't a day that I didn't leave crying, because that is what pained me the most. I am happy to say that following Monday, they actually relaxed those rules. So I don't know if I had an effect, but there were other members on that town hall that had concerns like I did, and we voiced them. Now, they did cut out certain aspects of my question. Like, I was cut very short. It was kind of funny. But regardless, the homes were then able to evaluate whether that resident was high risk, medium risk, or low risk. A high risk would stay in isolation for 14 days. Medium risk was able to maneuver around with a mask on, and low risk, they were free to roam the facility. Which, when you bring to the point of they're the most vulnerable people in society. to COVID, I would agree, but I would challenge the fact that what we did, or what we're continuing to do, because I can guarantee you they're going to lock down again. I can tell you without a doubt that that's coming down the pipe. And now what's happening is family members aren't even allowed in the facility unless they're double vaccinated, show proof of double vaccination, or succumb to a rapid test. That's what we've come to. That has happened. I got the call from a friend yesterday that's actually happening. So now we're restricting, in my honest, humble opinion, COVID isn't killing our residents at this point in time. We are killing them with lockdowns and mental health. I did not see one death from COVID in our facility, but there were multiple deaths. There were 12 deaths in our facility. They didn't die from COVID. They died from loneliness. They died from other health issues that perhaps were
comorbidities and all that.
Yes.
Yeah.
And I just honestly, if I could give one message to family members on this aspect, where's your line? You're willing to tell someone that to allow someone to dictate when you can and cannot see your loved one in a facility based on something like transmitting that has never been proven. They're telling you can't enter the facility because you're unvaccinated. Well, there's no, if your loved one is vaccinated, it just becomes this topic. So I really hope people fight back and really get involved in that aspect, because that's their home. You're paying money for your loved one's home. That's their home. And it's turned into something that it should never. So there's got to be a different solution.
Before we started, maybe at the start, I can't remember now. Yeah, you said you have to be loud because if you're not loud, nothing changes.
Yep.
And I think I can speak for myself for certain. And that probably means a good part of the population that just feel uncomfortable being loud. Like, I don't want to be loud. I just, just let me go and see, in the old folks' homes, you understand, just going back to the average age of death over the last 18 months, pretty much, is that, the old are obviously at risk, right? But at the same time, the humane part of it is, you almost wonder, like, why don't they, like, and I can't understand this. So I certainly have no medical background. I want to point that out again. Why you can't, like, have them sign a consent form. Do you care?
Yeah.
No. I'd like to see my family.
Yep.
And let them just see their family. And, that's probably easy for me
We're
to say.
letting people dictate. Let's be very frank. These people that are making these decisions are sitting in offices, unmasked, unaffected.
Yeah.
They don't understand. Well, they might understand, or they're just choosing not to. But this is the most powerful message I got from one of the most dearest men that I will hold close to my heart, because he was a resident that hovered around my desk all the time. And he said, Sue, he was super angry, and he said, I lived 85 years for this to be locked up. For what? The inevitable? I'm going to die anyways at some point. And if going to McDonald's and having a coffee with my son brings me joy, I want to be able to do that. I don't want to die locked up in a home. I didn't live 80 years for this. And it was like probably the most humbling moment for me. I'm like, you're right.
Well,
you're right.
I feel,
and I took a resident out in lockdown. I stood my ground. I got loud, and it was his birthday, and nobody would listen to the man. Oh, they'd shovel him off. And I'm like, he was almost nonverbal. So he didn't speak a whole lot. And I'm like, oh my gosh, it's your birthday today. What do you want for your birthday? And all he wanted was to see his mother. So I marched into my boss's office and I said, look, I'm taking so-and-so around the block, because he apparently his mother lives close by, and I'm going to wheel him there. I will wear a hazmat suit if I have to, whatever it takes. But he needs to see his mother on his birthday, please. And they all looked at me and they're like, you're okay with that? I'm like, yeah. I wheeled him around. We cried together. His mother was like in total shock. And she's an elderly lady, right? So we're talking about two older people. And it was probably like the highlight of my life. And then we come back and it's like, holy crap, this is reality for every single resident in this building. They just want to live. Like, since when is the litmus test to life just about having a heartbeat? We're just living at this point. We're not actually living like full lives. So that's kind of where I went the other opposite side of the coin with long-term care. Yeah, it's important that we keep them safe, but it's also important that they have fulfillment in their lives. It's not just about a heartbeat and keeping them alive. And that's basically what it's turned into. That's all anybody talks about right now. Well, we just got to keep them alive. Well, there's ways,
Well, when it comes to COVID, and God, someday I hope we get to talk about the Edmonton Oilers again, or a little senior hockey or whatever have you. But, when you talk about the stats, either side, pro, against, it doesn't matter. When they're just numbers.
Yeah.
It's really, like, you can make the stats dance and do whatever you want.
Yeah.
But when you hear stories like that, you go, like, fuck, right? Like,
yep.
But I don't know what the answer is. That's the...
Well, I like you said, bring it back down to the residents and what do they want? Nobody's asking them what they want. And that, they some of them obviously can't advocate on their own behalf. They're, dementia, and that is the true reality. And that's probably the most heartbreaking ones, is they can't understand.
What's really frustrating to me, and now, as I hopefully get more people that maybe want to contradict me by all stretch of the matter, I'm good with it. I just, you understand that the only way out of this is what they're saying is the vaccine, which is whatever, right?
Mm-hmm.
But that's what they're saying.
Yeah.
The only way out of it is the vaccine. And yet we know that vaccinated people can get it and transmit and like pass it on again. So I go, like, your only way out still has holes in the armor, And on top of that, you got people that just don't want to take it. Now I go, look, so you convince me. There's gonna be somebody else that you don't convince, and that's gonna be always the way. Always, you're never gonna get 100%.
Nope.
It's impossible. So
and there's people who have legitimate reasons why they can't take
100%.
the vaccine. That is a reality.
So we're in this like weird world of like we have to get everybody.
Yeah.
And the only way to get society back on track is if everybody. And I'm trying to figure out like if this is like a 2-year thing, or like a 10-year thing, or like a 50-year thing, or what this is. Because
well, I knew that there was booster shots coming before anybody else knew because of the position I sat in as an office coordinator. That booster was already talked about when they rolled out the vaccine. That was another red flag. I'm like, we're talking boosters and we're just hitting the first shot. Like that was always a reality. That was always on the table. So like when they start talking about, I'm like, well, wait a minute. So after the second shots were administered, they were already talking boosters. So that booster that's coming within the next couple of months.
Yeah, well, they've already announced that it's going to be put to the most vulnerable beginning. So that'll be the elderly, frontline workers.
Yeah. And another uncomfortable question that nobody's talking about.
What do you think? I'm curious. There was doctors march out in Toronto.
Yeah.
Actually, I think it was staff, not just doctors. But I've been hearing a lot of buzz lately around a lot of nurses quitting their jobs, leaving that. I've been told teachers are mandated. There will be teachers that walk away.
Oh, it's coming down the pipe. Yep.
Well,
That's coming.
I think we all know it's coming.
Yep.
Have you been hearing lots of that too?
Yes. Yep. People have this idea that all healthcare workers are pro-COVID vaccine. I can't stand the term anti-vaxxer because it's just not true. They're allowed to question every single vaccine that they come in contact with. So like every other vaccine that came down the pipe, do we really know if every single healthcare worker has every single vaccine out there? No, we don't. So stop calling them anti-vaxxers.
We've never asked that
and
before.
we've never asked that question.
No.
But it is coming down the pipe, much like me. I chose to take a stand that, no, you're not going to discriminate against me just because, I love my job and I want my job. But I really think that we're in big trouble because there are multiple doctors, multiple nurses that are just going to say, you can have your job. I will find another career. I will make something else work. And what's that going to do? We're already short-staffed in healthcare. We're already, scrambling. We're in trouble. In my opinion, we're in trouble because they'll just walk out. A lot of those doctors, some of them are, reaching their years where they're almost ready for retirement anyway. So they're just going to say, screw this, and I walk.
I've heard about a Lloydminster doctor who walked out of his practice.
Oh my gosh! Like,
and
what are we doing?
I've talked to another one in town who said if they mandate it, he'll be done.
Yeah.
And I'm like, oh.
So now we're losing. So since when is the litmus test to a good healthcare professional a jab? Since when has that ever been? When is it the litmus test to being a good teacher come at the end of a vaccine? When has it ever become the litmus test to a deserving athlete? We talk about hockey. My children are heavy into sports. It's already the talk.
It's what I find really precarious about this situation is, and I've heard it, and I've tried to argue against it as soon as you hear it, but both sides, whether you're vaxxed or unvaxxed, are hoping the other side gets sick.
I know,
right?
Isn't that
so
sick?
that they can prove that by being unvaccinated, see, you dummies, you should have just got vaccinated. You're like, oh, geez, that's a scary thought. But the other side's saying the only way the other side are going to realize this is if a whole bunch of them. I'm like, Jesus, that's a fucking
I think that's
scary.
just horrible.
That's
like saying,
can we just back off that for a second and just be like, listen, we just need to find a way to bridge the gap here. Like, part of this is government fault across the board.
But like I said, Alberta Health Services mandates, that's where we lost everybody too, because their mandates made no sense. And I said to my boss, the only thing left to do is hop on one foot and toot a kazoo, because that's the only thing they haven't thrown at us. Like, they don't make sense. One day you're shielded, the next day you're not. One day you're wearing gloves. Oh, never mind, we're running out of supply, so don't worry about it. The millions of dollars that were dumped into useless mandates would blow your socks. We had to bring in extra dumpsters because that's how much garbage we had. Gloves. We went through, I believe, on average, $10,000.
And part of that you can kind of understand. At least I think I can understand.
At the beginning, maybe, but like
Well,
I said, it was like...
Because you're trying to figure it out. Like, listen, I wasn't in the... I assume... I'm just, assuming things, which is never a good idea. But in the beginning, when you're terrified, because I think all of us were terrified, like, what if this is the bubonic plague and 50% of the population out the door done? I don't know, right? Like...
Well, the mandates that I'm talking about came long after.
Oh, came long
after.
The
only mandate that was mandated at the very beginning was masks. And then I believe if you came in contact with a COVID, you gowned up and you gloved. But on average, the only person that was gowned up out the wazoo was the COVID screener at the front. So I'd wear a gown.
Is that public pressure then on the government?
Yeah, I think a lot of it is...
trying to make sure that we have no government or no outbreaks, no nothing.
Yeah,
because
possibly.
It's funny. I say this all the time. I feel like in the public, when you're talking to people, you could get a sense of where we were going, and then the government would come out and try and direct that energy their way. So in the beginning, you could have said jump on one leg is going to heal you, and all of us would have been, I don't understand it, but if that's what they're saying, I'm going to do it because I don't want this. And then a couple months down the road, everyone kind of went, well, this is odd. Like, nothing's really going on. And I've talked to enough smart guys that COVID is killing people.
100%. I would never deny that COVID is real.
100%.
But it's all about risk-benefit, risk factor.
Right.
That's what it is for me.
What
are my odds?
And I'll say right now, as we sit here, Sue, in the last 2-3 weeks, I know more people who've gotten COVID and are actually, whether they're getting tested, not getting tested, whatever they're doing, and they're being hit pretty hard by it, right? Like, I mean, a serious flu, I guess is what I'm trying to say. So it's like, it's out there. I don't mean to downplay any of that.
No, me neither. So I'm going to tell you this part, which will kind of trickle us back into the whole school part, but it has to do with my husband who had COVID. So my husband got COVID. My husband is a type 1 diabetic. So by all, mainstream hysteria, my husband should be dead. Because he's vulnerable, he is high risk, and it was so funny because I'm so vocal on certain things. The Alberta Health Services was like harassing him, literally. So he gave them my phone number. He's like, you know what, talk to my wife, because they wanted all of us to isolate because he had COVID. Well, I hadn't had contact with him, and then so they call me. I'm like, kids, I'm pulling over. I was in my vehicle, pulled over. Hi. And this is what I said to her. I said, you're telling me, she goes, well, it's just for your safety, ma'am. I said, okay, I can understand that, but I haven't had contact with him. Well, just to be on the safe side, I said, okay, let's talk about safety and health. You're telling me that my husband, who is a type 1 diabetic, and anybody who knows anything about diabetes, type 1 diabetics, it's not a funny disease, and it's deadly. You can die within a day. Like, it's deadly. And you're telling me that my type 1 diabetic husband has never been evaluated by a doctor. So he went to some random testing facility who are not doctors. I did rapid testing inside a long-term care too as part of that hub. So he's never seen a doctor. He's never seen a nurse. He's never seen one healthcare professional. You've told him now to go isolate by himself. Do you know what happens to a type 1 diabetic by himself when he goes into a diabetic
in the shock
fit? Come on. That is the most unsafe environment for my husband right now, is to be isolated by himself. Sick. But he's only allowed to go in to see a doctor or in the hospital, and when he gets so deathly ill that it's possibly past the point of no return. That is nonsense. That just right there, it made no sense to me. Like, so is this really about health? Like, if you really cared about health, you'd make sure that, a type 1 diabetic would contact their doctor immediately, come up with a plan, and let's get this man healthy. That's not at all what happened. We were proactive on the outside, and I contacted, his doctor and my doctor, and we came up with a plan. And okay, get your vitamin D's, get this. I could not get ivermectin. Ironically, there was only one doctor that was willing to potentially go that route.
You mean the horse stuff?
Yeah, but my doctor was like, you know what? Don't panic. Let's just wait and see. And it was a really proactive situation. But no, he did not sit in isolation by himself where I couldn't help him. So From that situation, a week later, I get a call from my children's school. Your child has been in contact with a COVID. I said, really? Who is it? Well, we can't tell you that. Well, how do I know if my child came in contact with COVID? Well, you just have to trust. Well, the teacher's allowed to make the decision whether or not they were a close contact. Why can't my child? So it became this, it's like, you know what? This is getting ridiculous. And again, I had that conversation with Alberta Health Services. I said, if you can't tell me, and I know what close contact means, it's 15 minutes without any PPE on because of the situation I worked in. I said, you know what? We're not doing this game. We're not isolating. If you can't tell me who I was in contact with or who my children were in contact with, we're not discussing this anymore. Case closed. They left me alone. Never heard from them again. So people just need to be, courageous enough or ballsy enough to take a stand. And it's amazing what you can accomplish when you take a stand. Sometimes we think, oh, well, you lost the end of the stick. So, Sue, you got pushed out of long-term care. Well, in the end, I don't view it as, oh my gosh, I lost out. I viewed it as I had a great experience. I'm able to take that and turn it into something else and hopefully pass the torch on to someone else to take a stand, and eventually it'll turn. But people have to take a stand. You know what I mean? Like,
Well,
I might have been like the example, but those people need to stand up.
You said it earlier, and I've if I go back to this is like last November.
Mm-hmm.
Me and my brother got in a heated argument, and we got in this argument of going back and forth. I think he's crazy. He thinks I'm crazy. We're just kind of clashing, and finally he says, "Where's your line?" And it was just it was the first time I'd ever heard it. Now you hear it all the time. Actually, I've been saying it on the podcast more because I think people really need to think about it, because it is not an easy question to answer, and everybody's is different. And honestly, when he asked it, I was so dumbfounded. I looked at him and said, "That's the best thing you've said this entire time." And he goes, "What?" And I'm like, that right there is a good point, and I don't have the answer for you. And I've thought about it now. It's almost been a year, and as the temperature goes up and things, can I not agree with most people in saying, I thought once we hit the 70% or the 65%, that things were going to loosen. Except they didn't have it. We're back to summer. They didn't say back to life, back to whatever. They made sure in the verbiage, because I saw tons of people comment, why isn't it back to normal, right? Everybody can kind of feel out what's going on. Listen, a big problem people have had and along this entire thing is the kind of the stymieing of information. They really have put a hold. And maybe there's been a reason for that, because if we all knew how little they knew, maybe we'd all freak out and go, or maybe, I don't know. I can't sit here and act like this is a giant conspiracy. I don't think it is. I think there's a lot of good people in good places trying to
do what's right.
And go man, there is not one size that fits all. This is a shit show. And we got problems over here and we got problems over there. How do we put out a blanket thing to make everything kind of smooth?
You can't please everybody.
You can't.
And that's a fact. And
that's leadership, though.
So
right? And so right now, we sit as the group that are very unhappy. And we're just trying to figure things out, right? And I go, if I get vaccinated, does this all go away? I keep thinking that. I'm so does it all go away? And then it's
I knew it wasn't going to go away because I knew the booster was around the corner. So for me, it was if I take one, I got to take the rest of them that come.
Right. Well, and
the
so go
risk
back.
benefit for me just wasn't there.
So go back to your line thing. I think it's a good point. People need to figure out where their line is. Because
that's in all aspects. That's with COVID. That's with schools. That's with everything you deal with in life. You have to have a line somewhere. And my line, I draw the line when it's not even my own. If you think that someone's rights need to be trampled on, I draw the line.
I got to give a shout out to Vance Crow. He's a guy who's been on the podcast a couple times. He lives in the States, and I sent him a message because I'm maybe I'm going crazy. Sometimes I just feel like I'm going absolutely crazy, and I'm not sure if everybody listening is you are going crazy. So I sent him a message, and he said, I think all people must now draw a line to know where they won't go. Yep. Rights are eroded incrementally, so you have to be flexible enough to be a part of society, but rigid when it comes to an important point. And I was like, man, that's beautiful. And
That
that's what
is
Vance Crowe
really
does,
awesome.
right? He finds a way to just like
Yep.
make it concise, right? Like that's the problem. And Rain,
Yeah.
I think what needs to happen is more people that have been just kind of like going with the flow. They want to change that. That's fine. I'm good with that. You want to change that? Yeah, honestly, it doesn't really affect my life. And, they want
It's
to...
funny you say that. That's exactly with the school situation. You don't understand until it affects you.
Right.
And that's what happened to us.
Well, let's
That's what
talk about
happened to me.
let's talk about the school situation.
Okay.
Sure.
So the reason I became so involved in schools, so to speak, so I don't sit as a board of trustee, but I've researched every school law. And the reason I'm not even attempting a board of trustee at this point is because the new school that my children attend, it's actually wonderful. We're very fortunate that it's the right fit. So it's not that all school boards across Alberta are these evil people and we just need to upheave everybody. That's not the case. So
I would hop in and say I would agree 100%. I think they're all great people. It only takes one to really mess things up.
couple,
For the
exactly.
most part, they're all really good people. And I think a lot of them think they have the public's best or school kids' best interest at heart. It only takes a couple to really mess things up. And any board I've been on, it's quite evident. But carry on.
Yeah. So I would say that, almost 4 years ago, I was that naive parent that just went with the flow. You send your kid to school and, I'm sure they're fine. I'm sure they're safe, whatever. I didn't even know what a board of trustee was 3.5 years ago. I was so, I was too comfortable, as the word I would use. I was way too comfortable, and that is the problem, is we're way too comfortable, and now we're not willing to get uncomfortable. And all of a sudden, it ended up being, a missing principle. We're talking about an extremely tiny school. So K to 12, it was 175 students. Preschool to 12, actually, 175 students. I volunteered all the time at the school. I was involved in that aspect, but not involved whatsoever with behind the scenes, policy making, all that kind of stuff. Then when we realized it was a really serious situation, we didn't focus necessarily on the fact that our principal was missing or absent, or they use the word absent. We focused on the fact that we uncovered that 4 kids were taken off school property in names of a social justice issue. This is where people could not let their brains go there. It's impossible that kids were taken off school property. That just doesn't happen. It's illegal. It's not allowed. Well, it did happen. As you read, it's in legal documents that it happened. There's no debate that it happened.
Yeah, well, they got taken off of school property under the, I don't know, is guise the right word, of...
under the guise of Bill 24, which no longer exists, by the way, but in efforts to have, to talk about safe spaces. And again, this is a super uncomfortable topic.
Oh, 100%.
Super,
well, what was the
sensitive.
group? What was the group they were trying to form?
So and this is where it gets very tricky. The group had a gay-straight alliance. It was painted in the media that they were trying to, and it was stymied, and it became this big, political realm. So very interesting enough. This came out right during an election time. Ironically, we're kind of sitting in that same boat. So it became very evident that it was a serious, topic, and it was more to do with a social justice issue. But we as parents did not cling to the crutch of a social justice issue because at the end of the stick, it was irrelevant what it was for. Under no circumstance should kids get taken off school property, no ifs, ands, or buts.
Without
parental knowledge or consent.
Yeah.
So at the end of the stick, it had nothing to do with that. That was just kind of the bubble of it. But the actual problem was communication, was policies that were being passed, and board of trustees that sat silent. That's where, and I was like, holy man. So we mobilized as parents very, very quickly. Well, I would say within a day. Well, it was within a day. So I had formed a Facebook page instantly, and I invited everybody I knew and said, hey, if you go to this school, we need to mobilize. We need to, because we had no idea what had gone on, to be very honest with you. It was just chaos. And we knew something major had gone on because our children were living a very traumatic situation inside of the school. So the teachers were actually told to zip it, stay silent. They were not allowed to answer any questions from parents. You are just to say, we're not talking about this. And so it became like this tug of war in the school where our children were like, we know something happened and you're lying to us. And it became like a battle between teachers and students. And like you said, parents and teachers battling it out. And it stuck that the teachers in the middle of the battle. One thing we were able to do is, I would say, like, join arm in arm with teachers, which went to our benefit because we didn't pit anybody as the enemy at that point. We're all in this together. We just need to figure this out. And that's why I'm just such an advocate of get on your parent councils, get on your trustees. So we discovered really quickly.
The way to... I'm just trying to attach it to what's going on right now, right? Because roughly a day before. Now, once again, I'm not advocating, I guess, for or against masks, but I'm advocating for why would we go yell at the people that are teaching our kids? Yeah. You need to find a way to bridge that gap and focus the energy on what can actually make changes.
Well, what I would hope the teachers would do in that situation is actually document what the concerns are and bring it forward. Hey, these parents have these concerns. Don't take it personal. Like that's the number one thing is they can't take it personal. It's not personal. They're just angry parents and it happens. Unfortunately, it happens. I've been there. I've been that angry parent and I've been that, okay, I'm really sorry. Hey, let's figure this out. So teachers need to document and bring it forward. Their first line is their principals. So get that to your principals and make sure that it gets into their union and into like this. It has to be a collaboration at this point. So if you want to, we can't be angry that these policies are there and we're mad because we didn't read the policies. If we were proactive in reading policies, which I learned the hard way that it's so important to read policies because hidden in the policies that nobody paid attention to was Bill 24. Nobody paid attention to Bill 24, which has now turned into Bill 10. So again, the mask mandates, the pandemic policy, it's hidden in your school board. It's there. How many people have gone to their board of trustee meetings? I can tell you because I attend my board of trustee meetings as much as I can. There's maybe one or two parents. Like it's really low. So it doesn't only take sitting on the board of trustees, it takes showing up, reading your policies, challenging policies that you don't agree with. So we're sitting in a really, I would say, positive time because there is an election coming up. So yes, make sure you know who you're voting for too. It's not just because I'm friends with Billy that Billy's going to be the trustee. What does Billy really believe? So for an example, you said you and your brother, don't necessarily agree. That's the same thing with the people you're voting into a trustee position. You might love them as a human and think they're the greatest, but they might not necessarily align with you want to see inside of that school. So elect wisely.
And be informed of when your elections are coming up.
Be informed of when your elections are coming up, which they're right around the corner.
For certain school districts, they're right around the corner, correct? I believe.
Yeah.
And I would say on top of that, they do meet, yes? And I believe that those are open to the public.
Yes.
So I would say if you're really concerned and you really want to make, a point of what's going on you're not okay with, that's the place to do it.
Absolutely.
I don't think... And I can't sit here and say that I've seen it. I've heard different stories coming from different places around the area about parents showing up to school on the first day of school and letting them have it. I would strongly consider not doing that. I mean, you got kids and everything watching, right? I would
strongly not advise that either.
But phone calls, emails, but like when those council meetings are happening, right?
Get to the council meeting.
Get in there and
get on the parent council meetings too. That's people totally undervalue parent council as well. So you have a direct line to the Minister of Education on parent council. Get on it. It's we've become very complacent and very like, oh, I'm too busy, or I'm too this, or, I got, I can't make the meeting tonight because, I'm painting. There's no excuse anymore. There's no excuse. It's so important if you value education, and like I said, I fell down the education rabbit hole. So just to backpedal a little bit, we were able to mobilize as parents. It didn't mean that we all agreed. That's the misconception that most people think is we all agreed. We didn't all agree, but we held meetings. We discussed. Okay, and this is what we did. We came up with a common goal, and we weren't going to challenge necessarily what was happening, behind the scenes legally. That was completely out of our control. But what we could tackle was our board of trustees. At some point, it kind of it divided us in the aspects that some people just said we're jumping out, we're switching school boards, and they laughed. So we lost like 35 families, I believe. And at first, we took it as an insult. Oh my gosh, like we're losing the battle. But it actually, what really turned the tides for me was when my own child became a target. And within that same school board, my child was secretly recorded by her phys ed teacher. That occurred 2 years ago. That was game over for me. That was my line. Okay, whoa. I can't keep my child in.
What was your line?
When my child was abused by a teacher. That was my line. In hindsight, I wish it wouldn't have been my line, but I learned a valuable lesson. So throughout all the kerfuffle and what it did do was it mobilized parents. It caused parents to have really important conversations with their kids, which is also important in this whole mask mandate situation. Get those conversations with your kids. So my kids already knew that 4 kids were taken off school property. Holy crap, you need to call me if something happens. What did my daughter do? When that situation happened, she called me immediately. Immediately. It was like, she was 11 at the time. She had the courage to go up to the teacher and say, "Are you recording me? Are you secretly recording me?" And he fumbled the phone and made a couple of excuses, and she stood her ground and she says, "You stop that right now. And what is my mom going to do when I tell her?" And he walked away from her. She ended up, this is what really made me sick about the situation. There was 2 of them. There was another little girl involved. And the 2 of them came up with a plan, like, okay, like if he comes near me again, we have math class with this man again. If he comes near me, we'll kick him in the shins and we'll, punch him in the face. And they came up with defense mechanisms to fight off a teacher, someone who they were supposed to trust. That was my line. So I pulled all 3 of my children out at that point. It was game over. I'm not doing this. And I learned a really valuable lesson there that what are you fighting for? What is your purpose? Well, I want my children to go to a safe and healthy school. That was not a safe and healthy school at this point in time. The trustees showed me that. They showed me that when 4 kids were taken off school property, and nobody was reprimanded in that, by the way. Nobody got fired. They all still remain there. That should have been a light bulb a long time ago, that there was a line. And what we were truly fighting for is it was a francophone school, so it meant people put their blood, sweat, and tears in building that school, and it meant so much to me. And it was a wonderful school, and we thought we were on top of the world in that school. We were on top of the world until they showed us that it wasn't. Until they picked on somebody that they shouldn't have. They tried to create a situation inside of our school that never should have happened, and it became political. That should have been my line. It wasn't my line, sadly. But once it became my line and I pulled my kid out, we eventually were shown what our board of trustees cared about. So in that situation, hopefully those board of trustees get voted out at this point. This is where it's so important to elect. I built a relationship in a different school district, and we uncovered that, okay, holy crap, not all school boards are evil and poisonous, or have, specific agendas or whatever the case may be. There are really good people out there. And I'm happy to say that my kids went to school with no mask. Our district decided no mask, but we as parents, there were many of us that wrote letters prior. We were proactive. Get proactive. We don't want to send our kids to school with masks. We're not going to enroll our children if they have masks on. We were very, very proactive in that aspect. So we didn't all walk off that school situation together, but in the commonality is we did have impact. And you as a parent have so much power. You just don't know it. So get involved. Get on your, if you can't, if being a trustee is not your in the right line at this moment, then get on your parent councils and get to your meetings. Get informed. Information is key. You need to be informed. And so as I fell down the rabbit hole, I can spew off Bill 24, I can spew off Bill 10, I can spew off the Education Act, all of that
But
stuff.
I think the message is if you're really concerned about what's happening, the way to go about it isn't to go yell at the teachers.
Absolutely not.
It's to get involved.
The teacher has no control in that situation.
If there's been a resounding thing I've heard from different people, whether it's professors, lawyers, doctors, etc., concerned citizens like yourself, it's been we got to get involved. You're not involved, you got no choice in what they bring down.
You can't expect someone to represent you.
That's right.
So as far as the teachers go, don't expect your union to represent you, because I can tell you right now, down the rabbit hole I went with my daughter, they don't. They have one collective message, and they're going to go with that collective message. So it's up to teachers to get involved in their union as well, not just expect them to represent you, but are you, because they have nominations within their own union, right? They have a president, a vice president, council, all of that within their own unions. Get involved. What are they actually, because I don't even know how many teachers know what's on the table for them, but the Alberta Teachers Association is heavily pushing to mandate masks in schools. That's right in their resolutions. You can go on their website and research all that. It's in there. And also hidden in that document is mandating vaccines. That's in the document. So that's how come I know that what's happening with our nurses and doctors right now and with Alberta Health Services, that's coming. That's coming to the teachers. It's eventually going to trickle into almost every aspect if we don't get educated.
I apologize if I feel like I'm distant. I'm getting, my phone is blowing up right now because Alberta's announcing their new restrictions and everything that's coming on. They're having a press conference. And I'm trying to listen and pay attention to that. Okay. And that is a terrible, normally I don't put my phone on. This is actually...
That's happening right now.
Yes. So normally what I do is I take this phone and I put it over there so the world can shake and I don't even think about it, right? And then you find out later that, oh, God, there was a whole whatever, because that way it's one-on-one. But
it's okay. No offense taken.
I knew it was coming, and so I put it in my pocket. I'm like, well, maybe I'll open it up and it'll be like, good news. Like, things are going to be status quo for a week. It doesn't, the amount it's rippling off my leg right now, that is not the case.
So what's happening?
I don't know. And so... I would love to sit here and chat more, but I can already feel my brain going different places. I really do appreciate you coming in. And before I let you go, I wanted to bring up one of the things I've heard, and I can't remember who said it from the beginning, but a very smart person once told me that schools are no different than any business. And your child being at school in the district is money that allows them to... get federal funding and everything else. And I'm paraphrasing.
Your child is over $10,000 to a district.
Right.
So it's a business at the end of the day.
So I'm not saying pull your child because, but once again, if you're that concerned, understand there is money that is associated to that. And on top of that, I would say don't do, like if you really want to make an impact, don't do distance learning in the same school district because they still get to claim that, right?
Bingo. Exactly.
So you got to.
You can hit them with the dollar sign by taking your kid out. 100%.
I'm just saying. I'm pointing out if you really want to play the game, because at times this is a giant game, and it is a serious game.
It's very strategic.
I'm not making light of the scenarios, but I hear about all the parents yelling and everything else. I go like, you got to focus. I think that's what you've brought up very clearly. You have to focus where you're going with that, and then you got to get involved.
When
right?
push comes to shove, what is your goal?
That's right.
What is your goal? Screaming at the teacher is not your goal, because if you're not going to follow through with pulling your kid out, then don't even go down that avenue.
Well, and I've heard that,
That's
right? They
kinda
come
where I'm
screaming
at.
and they give the kid, and it's like,
And then, oh, well, whatever, we didn't win.
Right.
So for me, with my daughter, my goal was a safe environment. My option was put her back in the classroom with the man who videotaped her or get her out. I got out.
Yeah, that's
if
easy.
that meant, it wasn't an easy decision in all aspects, because it was very traumatic. And it meant that I might have to homeschool. And it meant that my life had to change.
listen,
But
I don't
have to
I
get
don't
there
have
at
the
this
school.
point.
I don't have the school. Listen, I bring this up a lot, and I find it very hard to talk about the schools because I'm married to my
Yeah.
wife, and she's a fabulous teacher,
Yeah.
fabulous. And the school she's at is fabulous. Like, they're a great staff
Mm-hmm.
out there, and but I bring it back in my brain, day homes, right? Like where you send
Yeah.
your children. That is probably in my lifetime so far with young kids the hardest thing I've had to do, because you're entrusting somebody with someone who can't talk and tell you what's going on,
Exactly.
right?
Kind of like long-term care.
Ooh,
Same situation.
fair.
Yeah.
And it took me seeing firsthand my boy and I don't know how many times, I don't know if I've ever told this story aloud, except to close friends, but it took seeing him, geez, I'm making this out to be way worse than what it maybe is, but like he was distressed, had bite marks from other
Oh
children.
my goodness. Yeah.
He wasn't napping, couldn't get him to nap, and I just said, "Buddy, you okay?" And he just bawled, and he was like, I can't remember if he was 2 or 3, no, and it was like, boom, that day. It kind of gives me, it's a very,
Yeah.
I don't talk about it much, but in fairness, the places we got him into after that, you talk about great people, man. We've had some of the best day homes. Marilyn and Jim Donald right now are just fantastic human beings. And Sarah Rempel, wherever you are, was the lady that took us in afterwards. And Sarah Rempel, let me tell you, is an angel on this earth. She was fantastic. And I know her husband listens to the podcast. So what they did for my family was unbelievable. And I feel like as parents, we make out situations to be like, well, what are we going to do? But if you're that concerned, you have to get involved. And I think that if there's anything that comes out of this last part about the school, what's going on in schools or what not's going on in schools, right? Whatever your concern is, if you're that concerned, you have to understand you got to get involved. You can't, a simple yelling at something.
Same thing with teachers too. Because teachers, they need teacher leads on parent councils. So those really awesome teachers, get on your parent councils and link arms with your parents. We want to support you. That's the thing. And that's what that whole school situation we kind of slowly dabbled into. At the end of that was because we were so upset that they were trying to get rid of our principal that we loved, who made our school what it was, and we were pissed off parents. Don't you dare do that to us.
Yeah.
And we taught them, 75 kids left that school. We taught them exactly what we thought about that. You don't do that.
Well, and you do 75 kids times the dollar amount.
$750,000 at the end of the stick. So teachers, there's an avenue for you too. You're not alone. Parents are there to support you. The crazy ones that are screaming at you, it's not personal. Let it roll off. But you guys can get involved. We as parents can get involved, and we can make change. I've seen it. And I'm not getting on the board of trustees because my trustee is fantastic. She's phenomenal. I'm not pulling my kids out of my kids' school because it's fantastic in there. I honestly cannot rave enough about the high school my kids go to. My son plays hockey in Spruce Grove, which is 2.5 hours away from my home. I drive him 4 days a week because he wants to be in that high school. He doesn't want to bill it. He wants to be in that high school. So that just screams volumes that there are good people. Yeah. There's really good teachers out there. There's good trustees. Link hands in hands with those people and make the change. Create the change you want to make. You be the change.
Well, I appreciate you coming in, Sue, and driving in to do it.
Thank you.
Yeah.
No, I enjoyed it. Thank you.
Hey, folks. Thanks for joining us today. If you just stumbled on the show, please click subscribe. Then scroll to the bottom and rate and leave a review. I promise it helps. Remember, every Monday and Wednesday, we will have a new guest sitting down to share their story. The Sean Newman Podcast is available for free on Apple, Spotify, YouTube, and wherever else you get your podcast fix. Until next time.